Jessica, and I'm going to be your RN today. How are you?
I'm fine. How are you?
I'm good. Awesome. Okay, is it okay if I call you Victoria?
Yes, that's fine.
Okay, great. This exam I'm going to do on is approximately going to take about 10 to 15 minutes.
Okay.
And it's very confidential. It's private. And if you don't want anybody in here, that's fine. Okay. I'm going to start. I'm going to wash my hands just to help prevent the spread of infection. We're going to start with, I took my patient's vitals beforehand. Her blood pressure was 122/77, heart rate was 65, her respirations were 18, her temperature was 98.2, and she's 100% on room air. So we're going to start with her skin. I'm just going to feel, and it's warm. Skin is clean, dry, and intact. There are no lesions visible. Her skull is normal cephalic. Her scalp is clean. It's clear. There are no parasites or lesions. Her eyes are both even. Her nose is midline. And okay, so next I'm going to have my patient to look up and away. And if I had a cotton ball, I would come from the side of each eye, and I would be testing for her blink reflex. Next, I'm going to get a sharp instrument. I'm going to have my patient close her eyes, and then I'm going to feel on each side of her, and I want her to tell me which side she feels the touch.
Right. Left.
Okay, great. Next, I'm going to have her open her mouth, and I'm going to have her clench her teeth several times. Great. Contractions are strong and equal bilaterally. Her trigeminal nerve is intact. I'm going to have her smile and frown, puff out her cheeks, and then close her eyes tightly. Great. Her cranial nerve 7, her facial nerve is intact. I'm going to take a look at her nails there. They're white and clean. Calf refill is less than 3 seconds on both hands. I'm also going to check both feet. Less than 3 seconds on both feet. Her eyelashes are averted, present and evenly distributed on upper and lower eyelids. Her eyebrows are present and symmetrical. They're black and they have no lesions. And I'm going to test her cranial nerve 2, the optic nerve. And I'm going to have the patient to cover one eye, and I'll have her to read off letters. If I had a eye chart in here, she would read that off. And then I would do the same to the other eye. And then I would have her to read the chart using both eyes. And if she was able to do that, then her optic nerve would be intact, and she doesn't wear any glasses or contacts. Next, we're going to assess her ocular motor, trochlear, and abducens nerves. And I'm going to have her to follow my finger. Great. There's intact, full, and without nystagmus. And I would have a pen light. I don't have one, so I'm going to use the light from my phone. And using this, I'm just going to check both pupils. Great. And I would also check direct and consensual constriction of the pupils, and how I would do that for direct. I'm coming in with the pen light, and I would do that for each eye. And then for consensual, I would do one eye while looking at the other on both sides. Okay, great. Okay, so pupils are round, reactive to light and accommodation. And how it tests for accommodation is I would have her to follow out my finger. And I'm testing for near accommodation and far accommodation. Her ears are symmetrical. They're even. There's no drainage. And I would use the pen light again to look inside the ear to make sure there are no foreign bodies. And I would do that on each side. And there's a small amount of cerumen. Next, I'll have the patient to cover one ear. And then I'll turn it, and I'm going to whisper a 2-syllable word.
Princess.
Good. And then I would do that on the other side.
Princess.
Good. So she was able to hear both words on both sides. Her cranial nerve 8, the vestibulocochlear nerve, is intact. And if I had an otoscope, I would use that just to check for foreign bodies, signs of infection, and wax buildup. Her nose is midline without deviation. Frontal and maxillary sinuses are without tenderness. Good. I'm going to have her to close one nostril and sniff out of the other one. And then do it on the other side. Right? If I were going to test for her olfactory nerve, I would have like some vanilla or peppermint, and then I would just hold that up to each nostril to make sure that she can smell. So next, I'm going to assess her lips. Her lips are pink and moist, and there are no cracking or no lesions. I'm going to have her to open her mouth. Mucosa is pink and moist, and there are no lesions. Teeth are present and they're white. Gingiva is pink and there's no edema or bleeding. Her hard palate is white with transverse regain. Soft palate is pink and smooth. Tonsils are present and pink with no swelling. Uvula is midline. I'm going to have the patient to say ah. Okay. Symmetrical soft palate movement. And then I'm going to stimulate the back of her throat and then induce her gag reflex. And that will prove that her glossopharyngeal and vagus nerves are intact. Her saliva is present. I'm going to have the patient to stick her tongue out. Tongue is protruding in midline. Hypoglossal nerve is intact. Okay, next we're going to start by assessing the skin. The skin is clean, it's dry, it's intact, it's warm. I'm going to assess the patient's neck, and the neck is symmetrical. I'm going to have her to extend the neck upwards, flex it towards the chin, and then rotate it from side to side. I'm going to put my hand, and I'm going to have her to push against resistance. I'm going to do it again on this side. Good. Trapezius and sternocleidomastoid muscles are strong, so the accessory nerve is intact. Next, I'm going to have my patient to stand up, and I'm going to check for chest expansion. Skin back and posterior is clean, dry, and intact. There are no lumps, no pain, no tenderness, and I'm going to have her breathe deeply. AP to transverse diameter is 1 to 2. Okay, and I'm going to listen to her. You can sit back now. I'm just going to have you take some deep breaths. Lung sounds are clear on auscultation with no adventitious sounds. I'm going to check my patient's lymph nodes. No lymph nodes are palatable. Okay. And next I'm going to check her carotid pulses. Pulses are regular, strong, and equal bilaterally with no roots. Good. Okay. And then this is the portion where I would go in and do the breast exam. So I would have the patient lean forward and put her hands to her side. And while she's doing that, I am checking to check and see if the breasts are symmetrical. And I'm checking the nipples and the areola to see if the color is even. And I'm seeing if it's inverted or everted. I'm checking for dimpling. I'm checking for retractions. I'm checking for drainage. And I would check her, have her place her hands above her head, and I would check the axillary and lymph nodes. Good. Then I would have my patient to change positions 3 times, and while she's with each position, I'm checking to see if the breast remains symmetrical. And then I would have my patient lie back, and I would palpate her breast with the circular pattern, and I'm checking. I would squeeze the nipples to see if there is any discharge. And no axillary nodes palatable, no masses, no tenderness, and no discharge. Next, I'm going to listen to my patient's heart. going to place my scope on the intercostal space, the right sternal border, the left sternal border, and my Erb's point. Regular rhythm and no extra sounds or murmurs. S1 is equal to S2 at Erb's point. I'm going to check the scan on my patient's arms, legs, hands, and feet. Scan is warm and dry, and it's intact. I'm going to check her radial pulses. Okay, pulses are regular, rate, and rhythm, bilaterally equal. 2 plus amplitude on a 4-point scale. I'm going to check her brachial pulses. Brachial pulses are equal, regular, rate, and rhythm with 2 plus on a 4-point scale. I'm going to check her posterior tibial pulses. Pulses are equal, regular, rate, and rhythm with 2 plus on a 4-point scale. And next I'm going to check her dorsalis pedal pulses. Pulses are equal, regular, rate, and rhythm, 2 plus amplitude on a 4-point scale. Good. Then I'm going to have my patient state her name,
Victoria Russell,
date of birth,
3/30/94,
and where are you?
Gibson's Hospital.
Okay, patient is awake, alert, and oriented ×3. And that concludes our assessment.